Hi everyone, are you all ready? Are you all excited to perform your first virtual procedure? First things first, make sure your hands are washed thoroughly and you put on your masks. Okay, the human heart is a finely tuned muscular organ that serves the whole body. It's around the size of a clenched fist and it sits in the chest, only slightly to the left of center. It's protected by the body's rib cage. Together, the heart, blood and blood vessels, that's arteries, capillaries and veins, make up the circulatory system. The heart beats around 100,000 times a day, pumping approximately 4.5 liters of blood per minute throughout the body 24/7. Amazing. This delivers oxygen and nutrient-rich blood to tissues and organs and carries away waste. The heart sends deoxygenated blood to the lungs, where the blood loads up with oxygen and unloads carbon dioxide, which is a waste product of metabolism. Now let's have a look at a diagram. You can see here the heart consists of 4 chambers. The atria are the 2 upper chambers. These are the ones which receive blood. The ventricles are the 2 lower chambers which discharge blood. A wall of tissue called the septum separates the left and the right atria and the left and the right ventricle. Valves separate the atria from the ventricles. The heart's walls consist of 3 layers of tissue. The myocardium is the muscular tissue of the heart. The endocardium is the tissue that lines the inside of the heart and protects the valves and the chambers. The pericardium is a thin protective coating that supports the other parts. And the epicardium is a protective layer consisting mostly of connective tissues, and it forms the innermost layer of the pericardium. Okay, we're about to begin the surgery. Is everyone ready? So, let's check if all the instruments are well set up by the surgical technologist. The role of the surgical technologist is also to prepare sterile solutions, medications used in the surgery, and also to check that all surgical equipment is working properly. Look around. Focus your eyes on the currently displaying instrument name and confirm each of them. What are they called? Take a moment, use your controls, pick up and examine the surgical instruments in front of you. The nurse has already checked the blood pressure and the pulse of our patient, which has shown a reading of normal, which is good. You can check the readings beside the patient's chest. Now, pick up the electrocautery pencil. Start to make an incision. Put the electrocautery pencil to the after use plate. You can see it there. Now pick up a surgical hook. Place the surgical hook to the patient's right side of the incision. Now, use your right hand to pick up the other surgical hook. Place the surgical hook to the patient's left side of the incision. Okay, next, please pick up the retractor. Now, place the retractor to the incision. Next, let's take the heart-lung bypass machine and use its tube to reroute the blood through the rest of the body so that we can repair the heart. This machine also keeps the heart warm and with enough oxygen. Effectively, it keeps your patient alive. Okay, grab the first tube. Place the tube into the aorta. Grab the second tube. The second tube. 2 additional tubes are placed into the heart to preserve the heart's temperature. Our bodies have muscles that we control and others that are controlled automatically. With the help of your peripheral nerves, you're able to carry out the voluntary and involuntary actions that you need to take. If you pick up a ball, take a step, or just wave to someone, you're performing voluntary actions. You make a conscious decision to perform that movement. Your brain receives nerve impulses and analyzes them before you decide what to do next. However, your heart muscle beats without your conscious control. Involuntary actions, such as this, are regulated by your autonomic nervous system. The autonomic part of your peripheral nervous system ensures that your heart functions smoothly. Now, let's stop the heart beating using the same machine so that we can repair the heart safely. The surgeon infuses a chemical agent called cardioplegia, which stops the heart's function. The solution often contains potassium ion, which has a quieting effect on the heart. The cooled blood circulates through the heart, causing the heart muscle to cool, and it will heat at a slower pace. The machine will maintain blood circulation. You can see on the monitor, if you have a look, that despite pulse slowing down, the blood pressure and the oxygen levels remain normal. This is great. Next, pick up the clamp. Put the clamp to the aorta. And at this point, blood will no longer flow through the heart, and it's safe to be repaired. Touch the new blood vessel revealed to let its ends attach to either side of the deceased area of the old coronary artery, allowing blood to flow around the blocked blood vessel in the heart. Now you can remove the clamp by approaching it and just press the trigger button. Put the clamp to the after-use plate. You can see that. With the clamp being removed, the heart is allowed to beat again. What's going to happen next? Well, the heart rhythm will slowly recover. You can check the heartbeat on the monitor. Once the heart beats at its normal rhythm, well then we can turn off and disconnect the heart-lung machine. Well done guys, you've just performed open heart surgery. The nurses will take care of the patient from now on.
I'm a pediatric perfusionist, which is in the open heart surgery. What we do is we take care of the patient's life on a heart-lung machine when they undergo any open heart surgery procedures. For me is the job satisfaction, that you are directly involving in somebody's life, care actually of their life. So that could be a life-changing thing for them. Normal routine day also we get some exciting things happen. Suddenly we get some emergency comes up from a neonatal unit or comes up from other hospitals around the state. So everything actually will be very normal, and suddenly it changes, like Melbourne weather. Sunny one moment and the next actually it's rainy and cold. The job which not only gives satisfaction but also gives you direct involvement in the patient's care. It really inspired me that even without being a doctor, I can still take care of the patient's life and not take care of or contribute to the patient's lifestyle before and after the surgery. The basic qualification is any science graduation. Also, actually, you need to be attached with the hospital as a trainee in order to do the perfusion course. And so once when you qualify here, you can work in either of the countries. So what you will do is, once you finish your undergraduation, then you enroll yourself into the perfusion course. So that is through the university of one of the United States of America university, and then you get a certificate at the end of the course.